Hello friend, this is me Zubair Ahmad and welcome to my channel Learn and Live MD. So today I am going to discuss another important and the most common question asked in the residency interview. This question is regarding your strength. There are few common questions I told in my previous recordings and videos also introduce about yourself. There's also the you will face this question in every interview. Why internal medicine? Why this specialty? Why this program? Your strengths, your weakness. So these are the common questions. So I will suggest everyone to be prepared for these questions so that you can answer these questions with confidence. Let's start our today's question, which is like the strengths. So this question can be asked in different ways, like tell me about your strengths, tell me about your three strengths, uh, like describe yourself in 3 words, why we select you over others. So these are the common questions which will differentiate you from others. And through this question, like about your strength, they will know how you will be useful for them for the program, or how they will get the benefit from you for the program. So for the answer of these questions, I will suggest you to make the list of your strengths which you have. For example, if you have good clinical skills, you are good at the research work, you are good in the teamwork, or you have adaptability, or you have like passionate at your work, or you have the problem solving skills. So you have to make this list and select top three and prepare for everyone, but answer to the program depends upon which program you are given the interview. Like if some program has they emphasize on the research, so you have to put the research on the top. If some program is has the main focus on the the clinical skills, you have to tell the first the clinical skills. So you should make the list and be prepared according to the program which you are interviewing, and make the give the top three to that program. Before starting to the answers portion, I will suggest you one thing for your residency interviews, that do not memorize the questions. Try to write the bullet points. If you will memorize the questions and read the answers, it will lose its value. So try to write the bullet points and describe in your own words at the time of interview. And also be humble. Do not use such type of words like direct answers like I am the hardworking, I am the best problem solving, I have the great clinical skills, I am one of the best researchers. Instead of giving the answers directly to like that, try to give the examples and describe your experiences, like how you are hardworking, why you have good clinical skills, why you are good clinical researcher. So try to give answers like that. And also avoid including things in this question, especially in the strengths which are included in the CV. So if you have good score, do not include do not answer that thing in the strengths portion. So I think most of the students will have a good score, so it will devalue, and also they may know your score. So in the portion of strengths, try to give something extra which is not included in your CV. Okay, now let's start with the example of how you will answer. For example, if you are picking one of your strengths like problem solving, so you can say I think I have good problem solving skills. I remember a case when I was doing the rotations in my medical school. So there was a patient who came with acute abdominal pain, and it was severe, and surgery was consulted, and initially they thought that it's acute abdomen, and they decided to operate the patient. But when I reviewed the chart, the history and physical examination and the labs of the patient, I thought it can be the case of acute intermittent porphyria. So I discussed my case with the attending, and we changed the management plan, and the following day the patient's condition improved. So this is how you will explain your answer, you will give your experience, and this is how they will know like you are really good, you have really good problem solving skills, and you also have a good knowledge. Now the second example is of the teamwork. If you want to show your strength as a teamwork, you can say I also have good skills in the teamwork. I When I was in my medical school, I was doing this and that job. I used to work with the fellows, the attendings, and the students, and I really enjoyed the teamwork. And during that time, I tried to give my best to my patient's care. So this is how they will know like you love the teamwork and you also have interest in the teamwork, and you can help them to the patient's care and the safety. Another example about the clinical skills, if you want to present your clinical skills in front of the interviewer, you can say like, I think, or I have good clinical skills. I developed these skills when I was exposed to a variety of cases during my medical school rotation, and I had eager to learn. The time flew from 8 to 8. I never realized, because I was taking care of my patients, and this and that, whatever you can add, you can. And so like this, you can tell them like you are exposed to variety of cases, and also you are telling them like you can work for long hours and you have potential to work hard. So this is how you will give the answers to the interviewers to impress them. And like, if you will give the simple answer like, I am hardworking, I am like, I have good clinical skills, I am good researcher. So instead of this, if you will give the examples, they will know more about you. If you are answering like that, like giving the whole story, or whole experience about yourself, so that means instead of giving the single words, so that means you are giving them and the clues about your strength. So they are sharp enough, they will pick your clues, and that's how it will work. And thank you so much, and if you have any questions, you can comment below. I will try to answer as much as I can. Once again, thank you so much.